Good afternoon. I am Dr. Danielle Cherrick, and I'm a pain physician at OrthoVirginia, and I work in the McLean office. And we are talking about low back pain today, and specifically low back pain that comes from arthritis. So what is arthritis? Arthritis is stiffness and swelling that develops in joints. And joints are the spaces between two bones. And what kind of arthritis are we talking about today? We're going to be talking about osteoarthritis, because there's lots of different types of arthritis, but we're going to be talking about osteoarthritis, and specifically osteoarthritis and how it presents in the low back. Who gets arthritis? Well, the truth is that if we just took an image or an X-ray of anyone over the age of 30, there is an extraordinary possibility that you would start seeing arthritis present on those X-rays. But the question really is all arthritis painful? And the answer to that is no, not all arthritis is painful. And we could have arthritis in all different parts of our body, and we might not feel it. Now, individuals who feel arthritis tend to be over the age of 40, and really between the ages of 50 and 70 is sort of the sweet spot for when you start feeling aches and pains. How come? I get this question asked a lot. How come arthritis or pain is worse in the morning? And one of the reasons that pain is worse in the morning, and the main reason, is because we have things in our body, molecules in our body, that are actually actively fighting inflammation for us. And those things that fight inflammation for us are at their lowest level early in the morning. And we actually have things in our body that increase inflammation, because sometimes inflammation is good. And those things happen to be increased in the morning. So everything that's pro-inflammatory is increased in the morning, and everything that is anti-inflammatory, so decreasing inflammation, is low in the morning. So that's why sometimes things hurt more in the morning than they do later in the day. When we get back pain in the morning, when people feel pain in their low back, we can take a look at this slide and see what joints it's coming from. So if we look at this slide, we can see that it's pointing out something called the facet joint. The facet joint is the bones that are between the joint that is between the bones in your back. Those are the things that get arthritis in them and then become painful. And so now the question is, well, okay, we know that we get arthritis in our back. We know that it can be painful, and we know that it can cause back pain, but what kinds of pain? And if we look at this next slide, this shows the areas of your body that you may feel pain in when you have arthritis in your spine that is symptomatic. So, for example, you might wake up in the morning and say, God, my low back really hurts. It hurts back, right back there. And it's not going down the leg, and it's not burning down the leg. That is most likely, especially if you're in between the ages of 50 and 70 or over, coming from arthritis. And even sometimes you can have pain in your butt that comes from arthritis. It is less likely if you have pain radiating down the legs that is coming from arthritis. So we're going to take the slides down now for a minute. And the next question, and I think the most logical, is okay, so what do I do to treat this arthritis? What options do you have? There are different things that people can do to help treat pain from arthritis. Sometimes people take medicines like anti-inflammatories. Sometimes you can have physical therapy or a home stretching regimen. Sometimes people try those things and they don't work. And there's other treatments that we have in our offices to help with that. Things like radiofrequency ablation or rhizotomy can help with pain that comes from arthritis, where we attack the nerves that are going to those small irritating joints in the back and see if we can help. We sort of burn those nerves to give you a long-standing pain relief and help you feel better. So that's kind of my general spiel on why your back might hurt in the morning. And now I was going to take some questions from the audience.
Thank you so much, Dr. Cherrick. We will be answering questions now, and including questions that were submitted earlier and questions submitted live. Not all questions will be able to be answered, but we will get through what we can. If you're watching live, please feel free to leave your questions in the comments right now. Our first question is, how fast should pain dissipate after getting out of bed?
I would say that for many people, they feel like the pain starts improving once they start moving. And I think usually a range of anywhere between 5 minutes to a half an hour, depending on how much you're moving, I think would be a reasonable time for the pain to improve. Though sometimes people, in my experience, say it can take about an hour.
Thank you. Does stretching help low back pain?
So some stretching helps low back pain. This is a very common question. First of all, there's people in this world who love stretching and they're all in, and there's some people who have never stretched in their life, and there's some people that are somewhere in between. What I would say is this: movement, especially in the morning, tends to help, especially when pain is secondary to arthritis, tends to help things feel better. So if there is a set of stretches in the morning that really help you, I would encourage you to keep doing them, and even doing them regularly if you're not in pain. Sometimes that can be preventative. Arthritis, and when you have pain from arthritis, does not respond well if you're doing a stretch that hurts. So sometimes people say, no pain, no gain, so it's okay to feel pain and then you push through. But when you have pain coming from arthritis, if you are doing something that hurts, that is not a good stretch for you to be doing.
Thank you. Are there recommended back exercises for low back pain?
So I had a feeling that this question was going to come up, not only because it's asked in my consults a lot, but also because it's a good question. And the truth is that the etiology, meaning where your back pain is coming from, will dictate what kind of exercises are going to be best for you. So if your back pain is coming from a pinched nerve, or your back pain is coming from arthritis, those exercises are going to be very different. Sometimes we use the guidance of physicians like myself or the other pain management physicians or other orthopedic surgeons to help guide an exercise protocol, also along with physical therapists to help really personalize your care. I wish there was some consistent exercises that we could say, give this to everybody and nobody will have back pain, but it just doesn't work like that. And even a search of the New England Journal of Medicine that I did last night showed that this was the answer, that there's not one recipe for every person.
Thank you. Is there a best way to sleep to reduce back pain? Does sleeping on your side make it worse, for example?
I would say the one thing that we know pretty consistently is that sleeping on the stomach is not great for the neck and the back. That being said, some people are just stomach sleepers, and so asking somebody to change the way that they're sleeping can be really difficult. So I don't think that anything is going to necessarily make the back pain worse. Sometimes there are certain positions that can reduce back pain, but that also tends to be pretty personal. Some people find that sleeping on their side helps. Some people find they've never been side sleepers, so sleeping on their side might help their back pain, but it doesn't help them sleep.
Thank you. Will my lower back pain cause me to not be able to move as I get older?
It depends. So if your low back pain is debilitating enough that it's already causing you to stop movement or to really curtail your activities, then getting seen is very important. That's something that needs to be treated either by medicine or PT or injections or a combination of all three. I do think that some people find that the more their pain increases, the harder it is to move. But if we can get ahead of the pain, then there shouldn't be a problem keeping people moving as long as they'd like.
How does lower back pain cause pain in the hip joints? Are they related?
So that is a good question. I talk about that also in a different Facebook Live about the distinguishing hip pain from back pain. There's all sorts of ways where the back and the hips have a relationship. It kind of depends on what hip pain you're talking about. Some people say hip pain and they're really referring to their butt, like the back. And some people say hip pain and they're referring to the groin. Sometimes you can get pinched nerves in your back that send pain to your groin. And in that way, back pain is mimicking hip pain. Sometimes you can have arthritis in the back or a pinched nerve in the back, which can send pain into your butt. And a lot of people come in thinking that they have hip pain, really butt pain, that's coming from their hip when really it's coming from their back.
Thank you. How is low back pain diagnosed? Do you do x-rays, an exam, MRIs?
So low back pain is diagnosed first clinically. You should go see a doctor to have your back looked at. Once you see somebody, sometimes all that's needed is an x-ray to assess whether or not you have arthritis. If your presentation is a little more complicated or there's a possibility that you might have a pinched nerve, then you would probably benefit from getting an MRI to see how badly that nerve is pinched.
Thank you. Are there treatments besides radiofrequency ablation?
So I guess when it comes to treatments, I'm going to assume the question is also asking, are there injections or other things that we do besides radiofrequency ablation to help with arthritic pain? Sometimes you can do joint injections, like an injection into the joint itself. Those are called facet joint injections. And there's also a type of procedure, and while it has the term radiofrequency ablation in it, it's not really that. Sorry, I don't know if you guys can hear this, but they are building something above me, so I apologize if you do. But that is called endoscopic radiofrequency ablation, and that's a procedure that's done in a situation where radiofrequency has been helpful, but then it stops working, and then you can take this approach where you are able to visualize the nerves with a camera. In terms of non-interventional treatments, there's medicine and physical therapy and exercises at home, etc.
Thank you. Can a mattress be the cause of back pain?
The mattress question I get also almost on a daily basis. Sometimes people find when they change mattresses or when they've slept in a hotel or somewhere with a different mattress, their back pain gets worse, or sometimes it gets better. There's not really a predictable answer as to what type of mattress one should sleep on to improve the probability that either their back won't hurt or that their back pain will improve. The one thing I will say is that if your mattress is up for being changed anyway and you have developed back pain, it's worth trying some out to see if there's ones that improve the back pain regardless. But usually a single mattress is not the cause of back pain. It can really aggravate it sometimes.
Thank you. Is there anything you recommend doing the night before to eliminate or lessen the pain in the morning?
Some of my patients have found that they have had, if they're able to, occasionally using anti-inflammatories the night before helps the morning be more comfortable. Also, some individuals feel like stretching ahead at night can help sort of loosen things up so that when the body becomes sort of more inflamed naturally, you're starting a little bit at a better baseline. So those are a couple things that I can recommend.
Thank you. Does being overweight make the back pain worse?
So sometimes weight can have a significant impact on how we feel arthritis, particularly in the hips and the knees. Obesity or being overweight can contribute to back pain, and I have found that a lot of individuals who lose weight have improvement in their back pain. But part of the reason also is because people that are on a weight loss program often have an increase in activity, and the exercise alone is also what's making the back pain better. So certainly rapid weight gain or being overweight could make back pain worse, and losing weight can help make back pain better, but it usually helps make back pain better also by the things that are associated with weight loss, like increased movement and exercise. But there's plenty of people that have terrible back pain that are not overweight.
Thank you. How can someone determine if it's muscle pain or joint pain in their back?
So that is a very good question. Oftentimes when joints get painful, they can cause muscle spasms. So sometimes you're actually having both muscle pain and joint pain. An examination can help determine whether the dominant pain generator is a muscle or is the joint. It's very hard to determine on your own if it's muscle pain or joint pain. Sometimes they live in the exact same area, and getting an assessment can really help.
Thank you. Does acupuncture help?
So acupuncture can help with lots of different pain presentations. I always encourage people to explore different opportunities to help their pain. And I have had patients have really great success with acupuncture. Not all of them, but some really have, and it certainly cannot hurt, in my view.
Thank you so much, Dr. Cherrick. That is all the questions that we have for today. Would you like to close?
Sure. Thanks so much for tuning into this Facebook Live. And if you have any back pain or any pain at all, please feel free to see one of our pain physicians here at OrthoVirginia or me at McLean Tyson's. Have a great afternoon.